Hello, my name is Madeline Anderson. I am CPCA's Program Coordinator of Health Professions Education, and today I'll be giving an update on the HPET initiative and RTAT progress. As part of HRSA's Health Professions Education and Training Initiative, Community Health Center Inc. developed the Readiness to Train Assessment Tool, or RTAT, to assess and improve health center readiness to engage in health professions training. Community Health Center Inc. defines readiness as overall indicators of a community health center's overall readiness and commitment to engage in health professions training. So this just means, do you have the resources, the workforce planning and processes, and workforce culture to support health professions training? So CPCA encouraged health centers to respond to the Readiness to Train assessment tool between September 2020 and February 2021. And the overall goal of the HPET initiative and RTAT is to increase the number of health centers who operate training programs to help address workforce shortages. We know that health professionals who train in a health center are more likely to work in one, so we want to make sure that health centers are conducting this type of training across the whole care spectrum for primary care, behavioral health, oral health, and other types of health professionals. The RTAT measures readiness by asking a series of questions relating to different areas of sub-skills of readiness. And these areas or sub-skills are represented in this diagram over here on the right. And readiness levels are assigned based on your mean score. So there are 3 levels. We have ready, approaching readiness, and developing readiness. And this is based on your mean score from 1 to 5. The RTAT also allowed respondents to assess for a specific type of HPET program. So respondents were allowed to indicate what type of health professions program they would like to assess readiness for. So they could take it with the lens of a medical program or a behavioral health program, oral health, or other types of programs. Now, what is the expected impact of the RTAT? So the first goal of the RTAT is to determine the level of readiness of health centers to engage in HPET. So we want to know where our health centers are at. Where are we in terms of our readiness to train? And next, we want to see what are the potential barriers that are preventing training advancement. So that's where these different sub-skills come in. We'll be able to look at those different sub-skills to see where there may be lacking resources, probably finances, but it also could be staff engagement or workforce planning and processes. So that's the second goal. And then the third is to develop and deliver training and technical assistance to health centers based off the RTAT results. And I'll be talking a little bit more about training and technical assistance at the end. So the RTAT closed at the end of February, and there was a very large national response. A total of 8,239 staff responded to the survey. The participation rate of health centers nationally was 73.3%. And the number of states and regions with the response rate of at least 50% was 49. So most states were able to have at least 50% of their health centers participating, which is great. And here is just an overview of response rate by state. In California, we had a 57% response rate, which is amazing considering how large CPCA is as a PCA. So thank you so much to all health centers who participated and the regional clinic associations who helped to promote the RTAT. It was a truly impressive response rate for our state and also for the nation. And these are just the response rates, but what about the actual data analysis. So let's talk about that. All right. Now, because there was such a large response to the RTAT, Community Health Center, Inc. will be releasing data in 3 phases. It takes time to analyze data, so these 3 phases allow us to have timely reports. So phase 1 is PCA initial reports. So these initial reports were released in June, and these reports included statistics on health centers with existing HPET programs, results for the Readiness to Engage subscale, and overall readiness by HPET program the survey was completed for. And I'll talk more about those results in just a moment. In phase 2, we have individual health center reports. So between September and December of this year, your health center will receive an individual report with a full breakdown analysis. The dissemination process for these reports is still being determined. You'll either receive it through CPCA or directly from Community Health Center, Inc. As soon as we know more, we will provide another update. And in phase 3, we have the release of state and national readiness reports, and this will happen by the beginning of March 2022, so next year. And this will include our analysis of state and national level results. All right, so let's talk about what the initial PCA report contained. So first, the report showed that most community health centers train in California. We see that 63% engage in health professions training as a workforce strategy to increase the pool of qualified health workers and better their communities. We also see that most health centers are ready or approaching readiness to engage in training. So of the 113 health centers that completed the Readiness to Engage in Health Professions training portion or subscale of the survey, 43% scored as ready, 50% scored in the approaching readiness, and 7% scored in developing readiness. We also see that from the total 76 health centers that completed the RTAT for all 7 subscales, so the entire survey, a majority of responses were for medical health professions training programs. And then the second most popular was behavioral health and substance abuse. Great. So those are our initial results. While we wait for the next 2 phases of data, we are hard at work developing and delivering training, technical assistance, and resources on HPET. So we will be offering training and technical assistance based off of the full RTAT data results, but until then, we are developing training and resources that help move the HPET work forward. So I'd like to talk a little bit about the resources we've produced as part of this initiative. So if you would like to access any of these resources, please visit cpca.org/HPET. We have a HPET webinar series. So this is a series of trainings to support health center workforce development and to increase readiness to engage. We also have a smart sheet library. So this is just a library of toolkits, reports, templates, and other recorded trainings available to health centers to assist with HPET. And we also have a package of promotion and peer-to-peer learning resources. So this is a series of templates that health centers can use to customize to their program, to market their program to the community, but also to potential stakeholders. As part of this package, there's also a promising practices document that CPCA will leverage to create a hub of promising practices on HPET. See how we can identify some of the barriers to HPET. We also have some exciting toolkits coming up. So we have the Health Professions Education Training template for assessment and action. So this is a strategic workforce planning resource. We also have a medical assistant development toolkit for clinical managers and supervisors. And we also have a community health center guide to developing clinical social worker pipelines and training partnerships. So those will be coming out in early fall. If you have any questions about the RTAT or HPET initiative, please reach out to me at manderson@cpca.org. Also, make sure to check out our website, cpca.org/HPET. And also consider joining our HPET work group. Our work group focuses on identifying barriers to health professions, education, and training for all disciplines. Also strategizing training and technical assistance, and then also strategizing partnerships to enhance training across the state. So if you'd like to join that, it's welcome to all members, and anyone, no matter the discipline, primary care, oral health, behavioral health, is welcome. We would love to have you. If you're interested in joining, please email Nicole Key at nkey@cpca.org. Thank you so much for listening to this webcast.